Welcome. My name is Robert Tasker and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. January 2023, Volume 24. I first want to commend to you Erin Bennett's podcast of the issue. As my editor's choices, I'm focusing on large data sets. The first is by Verlaat et al. From the Netherlands, and this is a large multi-center database looking at so-called low-risk patients and adverse events. There's an accompanying editorial about medical complexity and where we move on from here. The second editor's choice is by O'Halloran et al., and this is about adult survivors of pediatric onset long-term disease who as adults are managed in pediatric ICUs after in-hospital cardiac arrest. This comes from 17 centers in the Get With The Guidelines database. And again, there is an editorial. The third data set is by Ross et al., and this is a retrospective study from 9 PICUs looking at 2 variants of the SARS-CoV-2, original compared with Omicron. And again, there's an editorial that accompanies this. In the connections for readers, I'm focusing on 4 reviews, 3 systematic reviews and 1 scoping review. The first systematic review is about discharge directly home. There is an accompanying short or brief report from the same authors about their experience in a single center in Canada. The second systematic review is about antibiotic stewardship programs. And the third systematic review is about prognosis and goals of care communications with families. Interesting story here. I take you back to September 2021. We had some authors who wrote about a survey of 100 pediatric intensivists and physicians about their opinions on prognosis and goals of care. We also had an editorial accompanying that report, and interestingly, the editorialist and the writers of that survey have gotten together to write this systematic review. Finally, the scoping review is about diagnostic blood sampling and the development of anemia. So all in all, a great start to the year. I will be contacting you again later this month for a special issue in February 2023 to accompany the SECM meeting. I hope to see you at the meeting. Once again, Happy New Year. Thank you.